Hello, everyone. My name is Marissa Thomas, and I am the co founder and CEO of For the Breast of Us, a community for all women of color who have been impacted by breast cancer. I am excited today for you to watch this episode of Baddies Talk Back, where we are talking with the fabulous Dr. Sheri Prentiss, the founder of the Live Today Foundation. Dr. Prentiss, how are you doing today? Welcome.
Marissa, I am fantastic. Anytime I get to talk with a fellow breasty, survivor and co-founder of this work that we're doing to bless breast cancer patients is always a blessing.
Yes, yes, it is. And again, I'm excited to have you on. I'm glad that you took some time out of your schedule. I know that you're bouncing all over the place trying to help us women and make sure that we are living our best lives. And that's one of the things that we love to do here For the Breast of Us, for the ladies in our community as well. So, again, thank you so much for joining us. And right now we are in March, and March is Lymphedema Awareness Month, which is a great time to educate women, especially women of color, about breast cancer related lymphedema. So, Dr. Prentiss, can you share a bit about your experience with arm lymphedema after you had breast cancer surgery?
Yes, I was diagnosed with breast cancer back in October of 2008, and I underwent a partial mastectomy where they removed half my right breast. They
Mhm.
did a level 1 lymph node dissection where they removed 16 lymph nodes out of my armpit, so 3 were positive for
Okay.
cancer. And then I had 15 rounds of chemotherapy and 33 treatments of radiation. It wasn't until I was with my radiation oncologist that the topic of lymphedema even came up.
Mm,
And as a physician, I think sometimes treating physicians when they know that they're talking with another physician, can do the physician speak.
right,
But I try to reinforce to them, please treat me like a patient.
right,
Do
right.
not consider me as a physician because my mind is blown right now.
Hmm.
So she mentioned about a 1 to 2% risk of developing lymphedema. And obviously the odds were more than that. And so I did fine until I finished radiation treatment. And then about a month later, I developed swelling in my right arm.
Mm,
Now, before then, I had been feeling like this heaviness in the arm,
yep,
this pressure sensation. And when you have neuropathy from chemotherapy, sometimes those symptoms kind of mix and meld together. So
right.
which one is due to neuropathy and what could be creeping up with lymphedema? And
Hmm.
so although I didn't see any swelling, it felt tight, it felt heavy, felt a lot of pressure. And then I was also having increased pain, which again, we didn't know what that was due to the severity of the neuropathy and or lymphedema, because lymphedema can be a painful buildup. People
Right.
a lot of times think that no, it doesn't hurt, but no, for some of us, no, it can be a quite painful condition.
Hmm.
So I went into physical therapy for a month and it seemed like it took it all away. Then I
Hmm.
was wearing compression garments prophylactically to prevent it. And a year later, after I'm done with all of my treatment, was when it blossomed to, it was like almost overnight. I woke up with a limb that looked like and felt like it was twice its size. So
Right.
we thought I had a recurrence in on that side and a blockage, and that's what the swelling was due to. It wasn't. It was now chronic disabling lymphedema, which knocked me out.
Right.
Yeah,
Right.
yeah.
Now, we have a private Facebook group called Breast Cancer Baddies on Facebook. There's over 3,000 women of color all over the country, some actually who live outside of the United States, who are in this group for support, resources, things of that nature. And one of the things that we always hear, especially from women of color, is that they aren't even told about lymphedema. It's not even something that is a part of their treatment plan. It's not something that they are made aware of. And so, why do you think that is?
While a prevention model of care has been well established in leading cancer centers, and with leading cancer center guidelines, the concept of lymphedema prevention is relatively unfamiliar to patients, and physicians, I find, are reticent to bring the topic up because, oh my God, the patient has just been told they have cancer. And so
Right.
my focus is ridding them of their cancer. And we have created wonderful individualized treatment plans for patients when they are diagnosed with cancer, and the numbers of survivors are increasing. And
Mhm.
so the expectation and the anticipation is that these doctors are going to treat your cancer and rid you of cancer cells, but we have to put more thought into the survivorship portion of a
Mhm.
cancer patient's journey, right? So we need
Right.
to be cognizant about how she's going to live on the other side of this diagnosis. And so one of the things that the Live Today Foundation is doing is trying to impress upon patients: one, stand up for yourself, be an advocate, ask your treating physicians, do you have a lymphedema prevention program
Mm.
here? And if not, where can I go? And
Right.
the key is you want to ask them before you ever even start treatment,
Mhm.
because you really want to get like a pre-treatment baseline of
Right.
where your arm and hand and wrist are measuring, so that
Mhm.
you can be placed into a proper monitoring program, because lymphedema can show up 3 years after treatment has
Mhm.
finished, right? So you want to be in a program that's going to monitor you all those years so that you can get it, catch it when it's still subclinical, and
Right.
then not have to have your whole life. My career completely changed. I was no
Mhm.
longer able to do the clinical functions of my job. And so I'm passionate, as you can hear. I'm passionate about women taking control of their lives and, one, advocating for themselves, but I'm also working with my fellow physicians and
Mhm.
impressing upon them. As difficult as it may seem when you're first telling that patient about, your biopsy came back positive, you have cancer. I need you to still go ahead and mention, you know what? We're going to put together a treatment plan to get you cancer free.
Right.
We need to be cognizant. There's this condition called lymphedema, and 1 in 5 breast cancer patients will develop lymphedema. 1 out of 3 breast cancer patients who are at risk for lymphedema will develop it. So, but we got a program. We're going to
Right.
monitor you. Don't worry about it. It's going to happen in the background. We got you. But I
Mhm.
just want you to know this is part of your survivorship that we're going to start today to make
Right.
sure that this is not an issue for you down the line. It's all in how you position it, but
Mhm.
you got to
Exactly.
present the information to the patient.
Right. And I love that, Live Today and your foundation is doing that. That's one of the things that we're doing over here for the rest of us too, is just teaching physicians in the medical community, like, don't feel like you're going to fear mong us by not telling us something, or if you tell us, then we're going to go into panic mode, because we're already essentially in panic mode because you told us that we were diagnosed with breast cancer. But give us all of the information up front, so then that way we know how to navigate this thing called survivorship. It's how are we supposed to navigate it correctly or preventatively if you don't give us the information beforehand?
There you go.
Yeah.
There you go.
So I love that you had an experience with lymphedema. I did as well. I actually had a lumpectomy, and then I did chemo and radiation. After I had my lumpectomy, I also had about 6 or 7 lymph nodes that were removed. There was no cancer in those, thank God. But even after I had my lumpectomy, I started feeling some heaviness in my breast and on my left side. And one of my cousins who had been diagnosed, I want to say at least like 7 years before me, had
Mhm.
told me, like, oh, I'm thinking that, this may be lymphedema. You should try to go see a massage therapist and get like some lymphatic massage going
Yeah.
and see if that'll help. And that actually helped a lot. But just like what you were saying, I didn't go into full having lymphedema until I was in radiation, and like my whole left side like felt numb. It felt heavy. It
Yeah.
started to swell up a little bit. And then that's when my providers had told me, oh, you may have lymphedema.
Mhm.
So I guess one of my questions for you is, for any of the women who are watching, what can they do preventatively beforehand? Like, what type of garments, what things can they do preventatively beforehand to help before it becomes a problem?
Okay. Let me first share some statistics so we understand how critical this is.
Mhm.
80% of breast cancer patients are at risk for developing arm lymphedema. 1 in 5 breast cancer survivors will be impacted by lymphedema. Black women have a 3.5-fold increase
Wow.
risk for developing lymphedema. The opportunity to prevent chronic lymphedema is before noticeable swelling exists and before the arm feels this sense of heaviness. Those are the subclinical stages. Lymphedema develops stage 0, 1, 2, and 3. By the time you get to 2, it's visible swelling. It is chronic. It is considered irreversible.
Mm.
But in those stages of 0 and 1, oh man, if you're in the lymphedema prevention program where you're getting the right monitoring, that's when your clinicians can, if they're monitoring you correctly, can get information to now put you into an intervention mode, get you into the proper garments, wear them as dictated by the treatment regimen, and then you don't have chronic disabling lymphedema. There is this technology called bioimpedance spectroscopy, and it has the ability to measure and track some critical information in the body with our fluid status.
Okay.
And monitoring that fluid status is where clinicians can now be triggered, meaning your baseline pre-treatment shows that you were at this level. Now, as we continue to monitor you every 3 months, let's say 9 months out, whoa, there's been a change. That change signals a trigger. And now the clinician can come in and say, we don't see visible swelling, but the simple fact that we're able to monitor using this bioimpedance spectroscopy, letting us know that the fluid level have changed. You know what? Let's get her in some compression garments. We're going to get her in a sleeve. We're going to get her in a glove. She's going to wear that garment 12 hours out of the day for the next 4 weeks. And then we're going to monitor again and see where that level is. The largest randomized trial looking at preventing lymphedema using bioimpedance spectroscopy, 92% of patients did not go on to develop chronic disabling lymphedema because
Wow.
it was taught at a time when it was still in its subclinical stages.
Right,
And the
right.
test is so easy, girl. It looks like a scale. Get on it, your feet, you put your hands on it. 30 seconds later, you step off. You get to go on. It automatically is tracking you. So now you already have a profile. So it
Mhm.
just monitors. Bling, your clinician gets notified. Here is her score at 6 months, no change. 9 months, no change. 12 months, there's a
So,
trigger. She's
little
outside of her standard
elevation, yeah.
deviation. Bam, that's
Mhm.
it. And you
Yeah.
know, we go in for follow-ups all the time.
Right,
So
right.
now once I know, this just becomes part of one of my follow-up visits.
Mhm. Right. And it's
Yeah,
easy, especially if it's that
easy.
simple.
Exactly. Exactly. And the Live Today Foundation has been fortunate to be able to promote a campaign. It's called the Lymphedema Can't Ruin My Survivorship campaign. I
Okay.
got videos out there and I'm talking about the social device because truly, had this been available to me,
Mhm.
Marissa, I don't know where my life would be.
Right.
Now, I also know I probably most likely would not have developed the Live Today Foundation. I probably wouldn't have founded it, right? Because even though as a physician I knew of it, it
Mhm.
didn't become real to me until now I've been diagnosed with it. Now I'm expecting my insurance company to cover my compression garments, and they don't. It's
Right.
taken years before the Lymphedema Treatment Act finally gets passed, but
Mm.
we're going to have some progress to go before reimbursements and coverage actually takes into effect. And then that's just for Medicare. We still got to
Right.
deal with Medicaid and private insurance. And
Mhm.
so I can't go back and question and say, oh, I missed out, because there are women now that are being blessed in the Netherlands, Australia. We're
Mhm.
hitting Africa now, that are blessed with this. But man, I would most likely still be practicing clinical medicine to this day,
Yeah.
had I not been disabled by lymphedema.
Mhm. And
Yeah.
it's so, I was diagnosed the end of 2015 and did all my treatment 2016. And even just hearing this now, it's so much more advancement than what I had even when I was diagnosed,
Mhm.
which is great, like you said, for the women who come behind us or who are navigating survivorship right now, for them to have these tools. It's so much of a blessing.
It makes the world of a difference. And I've been able to compile on our website, one, if a cancer patient or survivor who is under resourced, they don't have the money, they can't afford the
Mhm.
garments. Go out to the Live Today website, and I'm sure you're going to provide the link, but it's
Yeah.
www.live-today.org. There's a tab that says request for free garment application. You fill out a simple application. We get notified. We send you a link. You pick out the garments you want. They get mailed directly to you. But what I'm really also proud of is that Lymphedema Can't Ruin My Survivorship campaign. That campaign, it lives and exists on our website. And the beautiful part about it is if you click the tab called Lymphedema Prevention tab, it tells you a host of information about lymphedema, the signs to look out for, how does it develop, and important information out there that individuals can download. You don't know the questions to ask your cancer care team,
Right.
it's there.
Mhm.
If you're wondering about, okay, well, what's more about lymphedema? What was those statistics that she gave? I can't remember them. They're out there under that lymphedema prevention tab. And here's the cool part, girl. Remember that bioimpedance spectroscopy that I was telling you about, that
Yes.
device? It's called a SOZO device. There is a tab on that page that says find the nearest SOZO provider.
Okay.
You can put in your zip code
Mm.
and it will delineate every organization in that zip code area where there is a SOZO device. Many patients have been surprised that the cancer care treatment center where they've been getting care actually had a SOZO device, but they weren't aware of it. But now they were able to go back and say, hey, I need to get into this monitoring program.
Right. Right.
And or let somebody else know if a fellow family member or friend was diagnosed, they can now tell them, hey, I didn't know about it, but you need to know that X, Y, and Z hospital does have this device, and you need to get yourself into a lymphedema prevention monitoring program so you can make sure you don't get lymphedema. I mean, it's so easy to find where this device is.
Right. I
Yeah,
apologize that my camera is over here messing up a little bit.
that's okay. As long as I can hear that beautiful voice. Marissa, you and I our paths have crossed so many times in this work that we have done.
It has.
It's always a treat to see your face, but if I don't, I recognize that voice anywhere.
Yes, and you're dropping gems anyway. So as long as everybody can hear and see you and what gems you're dropping because they need those, that's all. And I love that you have that information on your website. We will definitely direct the women in our community to go to your website to look for where they can go get this screening that's done close to them, apply for garments, if they need them and they can't get them through their insurance or their medical providers. Like this
Right.
is great, great information. One other question that I had for you that I'm seeing the rounds of people sharing pictures on social media. There seems to be some type of, and they didn't have it when I was going through treatment, of kind of like a garment that you could put on. And sometimes it looks like a whole full body, almost like a Marshmallow Man garment. I know you've probably seen it.
See, that kind of goes in line with my nighttime garment. I call it my oven mitt.
Uh-huh.
So yes. So your question is, what is that garment?
Yes, yes. What
Okay.
is it? What can you tell our community? What is that garment and what does it do?
So to treat lymphedema, you have manual lymphatic drainage, you have decongestive compression treatment that's done. The special massage techniques that either your therapist will do and or he or she should teach you to do. But I've
Mhm.
had to learn. I've mastered it now. I'm doing it now. I don't even know that I'm doing it. I can sit in there talking to somebody and somebody will say, does your arm hurt? You're rubbing it. And I'm like, oh no, I'm just doing my
Right,
massage.
right.
But then we have various different types of garments, right? So there are arm sleeves, different types, depending upon the level of compression that you need. Could be flat knit, it could be circular knit, it could be a gauntlet, it could be a glove. You could wear a bra, you could wear a camisole, you can wear a vest. Some individuals, if they've had bilateral mastectomies with bilateral lymph node dissections, they now have bilateral lymphedema in both arms,
Mhm.
maybe something in both hands. They may have something in their chest or torso and their bra. That may be when you see individuals wearing a marshmallow suit
Right.
because it's covering the whole top.
Mhm.
Then there are individuals that some may, because they didn't know that a lymphedema prevention program is out there now. They get diagnosed, and like me, I was offered, hey, let's consider a lymph node transplant.
Mhm.
Maybe we can take lymph nodes from your left groin, put it under your right armpit, and we can decrease some of that swelling. And that was a possibility for me, but I got a little nervous because anytime you manipulate lymph nodes, I'm like, well, now could I develop swelling in my left lower
Right.
extremity and maybe not get as much improvement in the decrease in swelling, am I right? So that wasn't a chance I was willing to take. But as a result, some individuals do now they need lower extremity garments. There are pneumatic devices that some individuals use at night before they go to sleep that they may keep them on for about an hour or so to help re reboot the system, if you will, and get that lymphatic fluid to get back into the lymphatic drainage system.
Mhm.
But some of that treatment information is also on the website.
Okay. I guess
Mhm.
one other question that came up while you were saying that, are there other things that women can do besides just wearing the garments? So, like, does moving and walking help?
Mm. Oh,
Exercise?
oh. Yes, you are asking all the right questions, and all these questions are on the website. So thank you. You are. We couldn't have planned this
Yeah.
better if we had tried, right? But yes, I encourage individuals. So one, wear your garments as instructed. That's one. And don't wear a nighttime sleeve. Don't wear a daytime sleeve at night. if
Mhm.
if you're instructed that you need a nighttime garment, get a nighttime garment. They are not interchangeable.
Okay.
Exercise is very helpful in doing things that are aerobic that get your cardiac system going is really good. I literally there are some mornings I may wake up and yes, now I pretty much sleep on my left, but occasionally if I'm in a hotel, I get discombobulated. I wake up and I would have slept a little bit on my right, so my right is swollen. I go
Mhm.
down to the hotel gym and I'm just walking on the treadmill. I'm not running. I'm not. But once I start getting a little bit of sweat, you literally can look at my right arm to my left arm and you can see the lymphatic drain. It's just bubbling up on my arm. It's fascinating. So,
Mhm.
yes, exercise helps. Watching your diet. There's going to be certain things that you may eat that you notice, ooh, I seem to swell up a little bit more with that. Watch it because it's individual. And if you say you're having pain and someone says to you, oh, girl, that must be something else because lymphedema doesn't cause pain. No, I'm not saying immediately accept it as that. If it's unusual pain, yes, you need to check it out. But yes, lymphedema can cause pain,
Mhm.
and your NSAIDs and Tylenol may not do the trick for it. You may need
Right.
something like a gabapentin or some other homeopathic supplement. Lipoic acid, alpha lipoic acid, has been known to be very helpful with lymphedema. So yeah, go out to the website, find out the other things that you can do to complement you getting the best care you possibly can if you've been diagnosed. But more importantly, if you have not been diagnosed with either a cancer diagnosis or with lymphedema, arm yourself now with the knowledge for yourself and or that person that you know and
Mhm.
love, or just know maybe you don't love them, maybe you just like them a little bit. Share the information so that they will do what they need to do so that they can prevent having chronic disabling lymphedema.
Yes, I love it
Yes,
because so many of us know somebody who was impacted by breast cancer, and maybe we see them rubbing on their arm or complaining about their arm or one of their extremities hurting, and this may be a click for them, like, oh, maybe they should
that's
talk to their
exactly right.
doctor.
That's
Mhm.
exactly right.
Yes.
Yes. Yes.
Well, Dr. Prentiss, you know how much I love you.
Yes, I
Thank you
love you
so,
too.
so much for joining me today and, equipping us with this knowledge and this education. That is one of the things that we're doing here For the Rest of Us is, passing along knowledge and education to the ladies out there so that way they're properly informed. And you definitely gave us all of the information that we needed. Do you have any parting words or closing thoughts that you want to give to Black and Brown women who are impacted by breast cancer and possibly lymphedema?
I will tell them, remember those statistics 3.5-fold increased risk, Black women, uh, for developing arm lymphedema. Uh, be your own advocate. Oh my goodness, don't count on anyone else. And now is the time more than ever to speak up because now I believe the path is wide open. Physicians are ready to engage in a partnership with you. So
Mhm.
join in that partnership about your care. Insist upon receiving only the best. And if by chance you find out the particular cancer center that you are at does not have a lymphedema prevention program, you love where you are, but they just don't have the program or they don't have a SOZO device, and you want to fall within that 92% of individuals who are in a monitoring program that has a SOZO device so that you don't get it, just go there for your lymphedema prevention. You can still get your cancer care treatment at the organization where you're at, but go where you can get monitored so that one disease, the treatment of one disease where 10, 15 years later, people are saying you're cured, doesn't cause another disease that you'll live with for the rest of your life.
Exactly. Yes, I love that. Well, Dr. Prentiss, thank you. Thank you again so much. And the Live Foundation will definitely pass along your link. We'll put it on our website as well. If you would like to be a partner with For the Rest of Us, we would love to put you as one of our partnering organizations.
100.
Yes. So we will definitely add you to our website as well. For everyone else that is listening and watching, thank you so much for joining us for another episode of Baddies Talk Back here on For the Rest of Us. And we will talk to you soon.